Dr. Dorie Seavey is the Director of Policy Research for the Paraprofessional Healthcare Institute, where she conducts research on economic, financial, and policy issues affecting the direct care workforce in the long-term care industry. She has served as an investigator at the Center for Social Policy and as a researcher at the Radcliffe Institute for Advanced Studies. Dr. Seavey has been published extensively in a variety of professional publications. She graduated BA from Stanford University and received her PhD in economics from Yale University.
My name is Dorie Seavey. I'm a labor economist and director of policy research at PHI, which is a national nonprofit based in the Bronx that works to help to improve the lives of people who need home or residential care by improving the lives of the workers who provide that care. PHI stands firmly behind the Fair Home Health Care Act, and we've been asked to address the bill from a labor market perspective with a focus on public policy development in the area of long-term care. I'd like to touch on 3 points: the changed context for considering this bill, the problem of bad market signals and mixed policy messages, and finally a word about costs. I would direct you to my written statement for in-depth analysis. The context for this bill could not be more different than the one that confronted lawmakers in 1974 at the time of the last set of FLSA amendments. Profound changes in the provision of home-based supports and services have essentially eclipsed the companionship services exemption. Significant changes have occurred in 3 areas: in the duties performed by many of the workers now classified as exempt, in the home care workforce itself, which now totals over 800,000, recently topping the size of the nursing home care workforce, and finally in the size and structure of the home care industry. There is no question that home care occupations are now bona fide forms of employment that generally are not performed on a casual basis. Nonetheless, home care workers need and deserve basic protection. The remuneration of this workforce is notoriously low, with mean annual earnings of under $15,000. About a third of healthcare workers' home care aides have no health insurance, and shockingly, nearly half of these aides live in households that receive some kind of public assistance, such as Medicaid or food and nutrition assistance. Propelled by demographic and other trends, home care is a rapidly expanding multi-billion-dollar industry in which for-profits constitute the fastest-growing segment. There is also a booming consumer-directed market financed primarily by Medicaid, in which consumers serve as the employer of record or as joint employers with agencies. It's my opinion that maintaining the companionship exemption in its current form contributes to significant structural problems in both the caregiver labor market and in workforce development for the home care industry. Furthermore, the exemption works to subvert key policy goals established by the federal government concerning the development of the nation's long-term care system. From a labor market point of view, maintaining the current exemption in only one segment of the long-term care labor market creates distortions and artificial segmentation of caregiver labor markets across the entire system. Striking this same work performed by an aide in a nursing home is unambiguously covered by minimum hour and wage protection. By supporting this kind of disparity, the exemption impedes the normal functioning of markets and serves to undermine the development of a stable, adequate workforce of paid caregivers to provide home and community-based services. From a workforce development perspective, the exemption acts as a barrier to the overall status of this occupation relative to other low-wage jobs. Bottom line, it is basically impossible to construct any economic arguments as to why other domestic or home-based service jobs, such as maids, cooks, housekeepers, and gardeners, should receive this basic protection, but home care workers should not. Lastly, from a federal policy vantage point, not extending minimum compensation standards to these workers will only serve to send conflicting messages that undermine several important elements of federal policy. To mention the biggest one, this exemption in its present form works to subvert the federal government's encouragement of rebalancing, that is, the expansion of home and community-based services relative to those provided in institutional settings, such as nursing homes. The cost of this bill needs to be carefully and thoroughly explored on a state-by-state basis. However, several factors suggest that extending basic employment protections to non-live-in home care workers is unlikely to dramatically increase the nationwide cost of services or seriously disrupt service delivery systems, so long as steps are taken to adjust service delivery management accordingly. 4 quick cost-related facts to keep in mind. Virtually all home care workers currently are paid at least the federal minimum wage. Live-in home care workers would continue to be exempt from overtime under this bill. The vast majority of home care workers do not work over 40 hours a week. And in at least 16 states in the District of Columbia, either all home care workers or significant subgroups of them are already eligible for overtime pay because state laws exceed the federal standard. If the argument is that the exemption is needed to help make home care for the elderly and those with disabilities more affordable, then I would submit to you that the proper way to do this is not to artificially depress the market-based minimum cost of labor, but rather, in the case of publicly financed services, to make adjustments in state reimbursement rates, and in the case of private pay services, to use the tax code to subsidize the purchase of care. In closing, this bill offers Congress an historic opportunity to send 3 important economic and social signals. First, that home care workers should be on an equal footing with respect to all other low-wage occupations. Second, that within long-term care, the home care labor market should not have second-class status with respect to compensation, and therefore with respect to its ability to attract and retain workers. And finally, that federal lawmakers can work together to coordinate rather than send conflicting messages about the direction of our nation's long-term care policy. Thank you.